All right, and we're going to give it a few seconds. For those who are just joining us, this is a live stream with Impact, the Illinois Medical Professionals Action Collaborative team, and we're doing a Q&A about vaccines. And so we're going to give folks just a few moments to join. But my name is Alia. I'm the Supermajority digital organizer and Pantsuit Nation admin. So some of you might recognize me. And we're just so excited to be joined here today with our experts from Impact. The reason why we wanted to do this is Supermajority knows that women have been and continue to be really critical in helping their friends and their family members get vaccinated, and also help us get to the other side of this pandemic. We also know that there's a lot of misinformation and disinformation, and that specifically targets women. So we want to give you reliable, accurate information that you can not only take on yourself, but also share with your friends, your family, and your networks. And that's what we're hoping to do here today. So today, our experts are going to answer some of the hundreds of questions you all submitted earlier. They're not going to answer all of them. They're just going to answer as many as we can. And then also, if there are questions in the comments and we have time, we'll also get to some of those as well. So if you have questions, feel free to submit them. And we'll also share some ways that you can get super vaccinated and get a sweet treat in the process at the end. So to start, I'm going to let our experts introduce themselves and share a bit about their work at Impact.
Thank you so much, Alia, for having us. We're so excited to be here. So my name is Dr. Shikha Jain. I'm a medical oncologist at the University of Illinois in Chicago. And I'm also the founder and chair of an organization called Women in Medicine, which is actually how I met many of the people who started Impact. So I'm one of the co-founders and I'm the CEO of Impact. And the way our organization was founded was at the beginning of the pandemic. We were all frantically texting each other and looking at Facebook and social media and Twitter and saying, oh my gosh, no one seems to understand this is a real problem. We should be pulling our kids out of school. Why are people out partying at the bars? And so we started our own kind of information campaign locally in Chicago. It basically was us calling our friends and family and telling our schools and our kids' future, camps and things that they needed to cancel what they were doing and start, hunkering down because a shelter-in-place order was coming. And what we realized was there wasn't any national plan for messaging or information, and a lot of the information that was going out there was inaccurate. And so we started Impact to really amplify the voices of the healthcare and scientist leaders in Illinois, and then eventually across the country, and put out information to combat the infodemic that was coming out there. Myself and Dr. Vinny Aurora were already experts in this space of healthcare communication and combating misinformation. And then our other founders all have varieties of other expertise and ways that they helped kind of grow the organization. And so now we've become a very large organization in Illinois, and we have a national presence combating misinformation and really putting out accurate and evidence-based public health messaging. I'll pass it over to Dr. Hala Akbarnia.
Hi, everybody. I'm Hala Akbarnia. I'm an ER physician, and I'm working in the suburbs of Chicago, also in the city as well. And I was kind of plucked out of social media by Eve, actually, who will be talking to you later, because I was doing a lot of work in our community, doing some of the things that Shikha was talking about, but just kind of on a more individual basis, just mostly for the community I live in, finding vaccine sites for people and basically testing sites. And at one point started getting a little bit frustrated out there because I wanted to help volunteer in giving vaccines. And after having done the front end of the pandemic as an ER physician, it was very demoralizing in some ways the past year and a half, having kind of seen what everything was like. In the beginning of the pandemic, it was nice to be able to do this end more like therapy. So started collecting a lot of volunteers out there to kind of do our own volunteer work, and eventually ended up being a part of Impact. And now our group of volunteers is almost 2,000 people, and we kind of staff different vaccine clinics and do a lot of canvassing out there and talking to people about hesitation and getting the vaccine. And we're kind of now on that end. And so it's been great being a part of Impact because they've helped me amplify this voice and this work. And it's just such a powerful group of people that all from all over the place, basically. I'm very honored to be a part of that. I also have 2 kids, and one of them's going off to college soon, so I'm a little bit. My house is looking like a little mini closet all over the place. But so, go ahead, Eve.
Okay. I'm Eve Bloomgarden. I am an adult endocrinologist, and I am one of the co-founders and the COO of Impact. And, to add to what was already said, one of the things that we have in this organization that I think is somewhat unique is that we're all parents and physicians or healthcare workers, and so we are really uniquely positioned in multiple different spheres where we're invested in healthcare and taking care of our patients, and in making sure that we're sharing evidence-based information about COVID and about staying healthy. But we're also very, very invested in keeping our children safe. And so we've been very involved in different discussions with school boards, with discussions about masking, discussions that I know a lot of questions today have come up about. We've written many op-eds and position statements about how to keep ourselves and communities and fellow healthcare workers and children safe. And so we have kind of the passion that comes just from being physicians, but also because many of us have young children. And I think we'll bring some of that to the discussion today as well, as you guys will see.
And I want to add one thing. So everybody in Impact is not a parent. I'm going to get angry medical students texting me.
No, that's true.
So all the founders are all parents, but there are a lot of members of Impact who are not parents, but who take care of elderly parents who might be immunocompromised, or who are on the front lines, or who are doing work, in the communities. We have non-physicians who are also a part of our team. We have nurses, pharmacists, we have social workers, we have public health communication experts. So we are a very diverse group of individuals. And I think that also lends itself to our ability to see all sides of the conversation and story, and help us really put out messaging that is the most impactful to help people understand where we're coming from and why we give the guidance that we do.
Amazing. Thank you so much. I'm so excited for this conversation. I'm so excited to be able to bring all of your expertise and knowledge directly to our members who, as we saw earlier this week, have a lot of questions still. And I love that you talked a little bit about vaccine hesitancy, because we know that even people who have gotten the vaccine still have questions and still do experience with that hesitancy. And if we want people to get vaccinated, and we want people to trust the professionals who are giving them the public health guidance, they have to feel really confident to not only do that themselves, but then to help spread the word to everyone else in their networks. And so to kick us off, I wanted to ask this question that Lisa, one of our members, asked, which was just about the process of approving the vaccines and how it was approved so quickly, as we start to think about like boosters and other rollouts to communities. I think that would be a really good way to kind of ground people in just like an overall general idea of where we've been, so that we can start to talk about where we're going.
So I can give a broad overview, and then I'm going to pass it over to Dr. Akbarnia, because I think she knows a little bit more as well. But I want to give a personal example first. So I have a 7-year-old and 2 3-year-olds. And I tell everyone this story. When I went to take my 7-year-old to get her first vaccine back, like when she was born, I will tell you, I got a little nervous seeing that needle going into her arm, because even though I'm a physician, I've read so much information out there, misinformation out there about how vaccines are dangerous and all, it runs the gamut when it comes to just the flu shot, talking about the flu shot. So I think it's really important to remember that it's very easy to get those kind of hesitancy feelings when you're putting something into your child's body or your own body. I want to remind people that although people say this was too fast, it was rushed, the power of this vaccine is, one, it's using mRNA technology that has really been researched for decades. It's not something new. It's just, this is the first time we found a virus that this is so effective against. That's number one. Number two, a lot of times the reason drug development and vaccines in general take such a long time to get to market is because there's all sorts of red tape and barriers that exist. Some of it is financial, some of it is bureaucratic. But in this situation, we saw the nation and really the world come together to put their heads together, to work together, to come up with a solution for something that was impacting every single person across the world. So it's not that this vaccine vaccine was rushed through. It still went through all of the same processes that any sort of vaccine that needs to come to market goes through. It went through all the regulation steps. And if anything, it was actually looked at even more closely than other vaccines that have gone through, because this was such a big deal and because so many people were being impacted. So it was not actually rushed through. It was actually it went through the exact same processes that normally take much longer. But because there was such an urgency to getting this done, that red tape and those bureaucratic barriers that used to be there and that still exist for other drug development were kind of removed in order to move this forward in an efficient manner. So I know that's a really big concern, but that's something that I want to reassure people that this wasn't actually moved forward in by taking shortcuts. It actually took every step and regulatory step that needed to be taken to do this as safely and as effectively as possible. Hala or Eva, do you have anything to add to that?
I think
that's right on.
Yeah, I was just going to say one thing just to add to that, is that normally when you do a study, it takes months and months to also gather the volunteers to actually do the study. And in this particular study, they still have people who are knocking on the doors to jump in on any particular study. And it took them almost 2 weeks to be able to gather 70,000 people, which normally would take almost a year or even more to do, and to take them through the process of getting them vetted for it. This was like people were just kind of falling on each other to be able to do this. And so that is a huge barrier to studies, is getting the people approved to volunteer to do it. And there was no problem getting that done on these. So that's just one more thing.
That was exactly what I was going to add. So
yeah.
Great. Thank you so much. And now that we've done that, I want to get into some of the more specific questions that we got over the course of the week. Of course, a huge question and a huge theme among the questions were around back to school and around people's children, something that's very present mind. I know some folks' school's already started, some folks it's just now starting or soon to start. So this wasn't a specific question, but basically kind of a composite of different questions about how do I keep my children safe at school when there's not a universal masking in place for students and teachers? And how effective are masks if only a few people are wearing them?
So I'm happy to start with this, and then we can build on this. I think we know a lot more about what's going on with this virus, how the virus behaves. And we know that, the best way to keep our children safe is to use multiple different layers of mitigation. And so, really important things, include making sure that everyone who's eligible for a vaccine in the community is vaccinated. So anyone over the age of 12 really needs to be vaccinated. All of the adults, all the teachers, everybody in the schools, in order for children who are not yet eligible to be able to be safe, because, you're building a protective shield around these children by reducing the transmission and just the rate of infection. So vaccination, I think, is number one. Number two, we know a lot more about ventilation. So it's really essential to have good ventilation systems in place. So, having good airflow, changing the filtration system, having your windows open or moving things outside to keep your kids safe. All of those things are going to be really important and helpful. Masks are the other incredibly important piece of this, and they're not the whole story, but when you add in universal masking into ventilation and vaccination, you give our children the best chance to be able to stay in school in person. And so what I say to people who are in areas of the country that do not have universal masking mandates, or whose school districts have decided against it, I first of all empathize with you, because that's a really scary situation, to not be able to know that your kids are safe. So we would encourage you to continue to write letters to the school boards, to work with the physician advocacy teams, to go to the medical boards and societies of your state, and to really keep pushing for it. The American Academy of Pediatrics, in no unclear terms, has stated that universal masking in schools is the only way forward at this moment. It is not forever, but it is something that is really important to add a layer of mitigation, because in-person school is only as good as being able to keep schools open. And so I think the focus would be on vaccination, ventilation, and masking, and really to keep pushing. So the question then becomes, well, if there is not a universal masking policy, what can you do to keep your own children safe? And that is where kind of the type of mask and the fit of the mask is going to be important. And so you want to have a mask that's tight fitting. You want to make sure, there's not a lot of air leakage. You want to see if you can get, at least 3 layers, or even, a tighter fitting KN94 or something that provides more filtration for your children. I'm fortunate to be in a school district where we do require universal masking. And I think I would keep pushing towards that. And then masks still work if your kid is the only one wearing it. They just work the best when everyone is wearing it. And so you're not eliminating, it's not that they're not going to help at all. And so absolutely still put your child in a mask if you're in that situation. And I think the more people who do it, the better. But there's more protection as more people are controlling the source of spread.
And I'll add to that, my 3 kids were all in-person school all of last year, and they had universal masking in their school, and they stayed in school. They had periods of time where, for example, one child came back positive with COVID and the class had to go virtual for 2 weeks, but there was no spread within the class because they had exactly what Eve mentioned. They had the masking, they had the spacing, and they had the ventilation. I also want to say, because my kids wear cloth masks, which are not as good as the, KN95 or surgical masks, but their faces are little. And so I don't know what I'm going to be able to get them to keep on that's actually going to keep keep them comfortable and actually keep it on their face. So the best mask is one that you can get your kids to wear and consistently wear and keep on. Another question I get asked a lot is, what about during mealtime? My kids' school, they implemented a really great system where the kids ate at their desks, and they had a little brown paper bag. They put their mask in the bag, they ate their lunch, and then they put the mask back on their face. They weren't allowed to get up from their desks and things like that. But again, the concern is there's a lot of schools out there that aren't requiring universal masking. And so I'm coming from a place of privilege when I say this, but I know there are parents out there who have pulled their kids out of school and have hired retired teachers to create a pod. So if you're really concerned, if you're in one of those really high transmission school districts where they are penalizing people for wearing masks, which makes my heart hurt when I hear about those types of things. If you're in one of those school districts, to keep your kids the safest, it might make sense for you to try to create a pod if you have the ability to do that with like a neighbor or someone else. I know it's not an ideal situation, but we all have to figure out how to keep our kids safe and also get them an education to the best of our ability.
And remember that kids, go ahead. Hala, go ahead.
No, it's okay. I'm just going to add one more thing, just because I come from a slightly different situation than both of Shikha and Eve. I have kids who are 15 and 18, and they are both vaccinated. So they're at school, and in our district also, we have a pretty high vaccination rate. So a lot of the issues that come up around here are, why should our kids be wearing masks at school? Because they're all vaccinated. And part of it is, and again, we are fortunate that the school has decided to go ahead and put a mask mandate in place anyhow. But I think it's all like what Eve said, every little layer does help a little bit. And so if you are thinking that the most important thing that we all believe in is our kids need to be in school, if that's our major thought, then we all should be okay with the fact that any little thing to prolong that process and how long the kids can stay in school will be a good thing. So thankfully, most of the kids that I know who are my kids' friends are okay with it. They'd rather not, but they'll go ahead and do it because they just want to be with their friends and they want to be able to do their activities. And, sports becomes an issue too, because a lot of sports are a little bit higher risk. And some of the schools also are instigating, many states are offering free testing for schools. So some of the schools are taking advantage of that. And for example, in our school, they're doing weekly testing where for kids who are in high risk activities like sports, band, choir, those kind of things. That's another thing that you can maybe suggest to your school to look and see what your states are offering for free without even having to pay for it out of pocket, which is another nice thing.
And so as part of Impact, we have an Illinois-based template letter that we wrote to our governor here, just asking for this mask mandate to be put in place. And we also have a petition that has about 35,000 signatures. That's a national petition to call for universal masking in schools. And we encourage people to borrow our language and to borrow our letter, change the state name and to use it and to send it. Feel free to update it. And all of that's on our website because, truly the answer is really to not tolerate policies that put your children at risk. And so, in the setting of a deadly infectious pandemic that is killing people, masks are not that big of a deal. And I think it is very unfortunate what is happening and what is being legislated in certain states. And as a parent, you need to do everything you can to fight against it. And please use our words or words from other physician societies that are being posted all over, including the American Academy of Pediatrics and the CDC, to keep pushing for that. Because really, our kids are vulnerable, and they, at least under the age of 12, they have no other option right now. We have to be adult about it, and we have to keep them safe. And then anyone 12 and over needs to be vaccinated.
Thank you so much. And thank you, Grace, who put the link to the letters in the chat. So folks are wanting to look at that, check the chat. In that same line, when can we expect vaccines for folks under 12? I know that's something that a lot of parents are asking about.
Oh, that's the $1 million question.
I'm checking my 8-ball.
I would like it tomorrow. There's been a lot of discussion that, we've been hearing mixed messaging about when it's coming. We heard the fall, and then we heard the winter, and then we heard early 2022, and then we heard the winter again. So I think that it's definitely a priority. I would say we cannot tell you with accuracy when that will be, but it's coming soon. I know that the trials have been accruing, as Hala mentioned earlier. Trials have been accruing so fast, even for the kids' trials, which, again, as an oncologist, I can tell you getting this many people to register for a clinical trial is amazing to have it happen this fast. So I can imagine it will be soon, but I don't know if we have an idea of when. And I also want to make the point, a lot of these school boards meetings, I'm hearing people say, well, kids don't get that sick from COVID, so it doesn't actually matter if they get vaccinated or not. I want to make the point that we know that kids can get COVID. We know that kids can get very sick and die from COVID. We know that the Delta variant is much more contagious, and we're seeing more children contract COVID with the new Delta variant. And even more than that, which I think this is important for adults and kids when it comes to the Delta variant and COVID in general, we do not know the long-term impact that this virus is going to have on our children or on adults. We already know that there's things like long COVID. There are symptoms that last for months. Who knows how long they're going to last? This virus is new. It's only been around for, a year and a half. So when you talk about kids getting COVID and acting like it's not a big deal, or you hear people talking about it, the big concern I have is, it may not be a big deal today or tomorrow, but it may be a big deal in 5 years or in 10 years. Who knows how it's going to impact their development? So, to people at the school board meetings, especially, who say, I don't care if my kid gets COVID because everybody's going to get it and kids don't get that sick. We don't actually know the impact this virus has on kids. So as soon as the vaccine is available, to answer your original question, I would recommend all of your kids should get it as soon as you can. My 7-year-old has been begging me for it since day one. So
Mine as well. And the other thing is, we are seeing a lot of kids in the hospital right now with COVID and with other respiratory infections and viral infections. And, any child that dies from something that's preventable is a tragedy, right? And I think when you look at the astronomical number of cases that have been occurring in the last couple of weeks, and including the number in kids, the numbers are really mind-boggling. I mean, over 4 million, I think, cases reported total, and I think hundreds of thousands were in the last 2 weeks, if I'm remembering the actual numbers here. But we have colleagues all over the country, and the children's hospitals are filling up. And what that means is, if there are no beds left in the hospital, even if your child has, let's say, appendicitis or breaks their leg, you still can't get the care that you need because the hospitals are full of other things. And every time somebody gets this infection, it gives the virus a chance to mutate and outsmart our vaccines. And so it's really up to every single person to be a wall and not be somebody that is going to allow that virus the chance to mutate. And so, I think as soon as the vaccines are out, we're hopeful it's coming very soon. You'll see we will be first in line with our children, and we will be sure to advertise that everywhere so that people can see us doing it, and feel confident that they can follow suit.
I have to say that probably one of the most amazing moments of my own life was being able to put the vaccine in my own son's arm. It was pretty. It was pretty amazing. I had to hold back the tears so I wouldn't embarrass him because I was just happy that he allowed me to do it. But the other thing is, there's a lot out there that you'll see one anecdotal case on somebody with a really bad reaction from the vaccine. And there's no way that you're going to have a vaccine given to millions of people and not have some adverse effects. That's just life. At the same time, life goes on. So things that normally would happen in a population, like a given number of disease processes that normally you would see in a population, are still also going to happen. So that there are a lot of people out there kind of sifting through the data to be able to see really what that means. We saw that with adults with J&J and the cerebral thrombus complications that came out of that. And then we really realized that a lot of that was the same number of incidents in the population that normally would be there. It's just that we're vaccinating millions of people at once. One of the things that people do is they report on a site called VAERS, which is Vaccine Adverse Event Reporting System site. And that's where anybody can report any reaction. So there are a lot of people reporting on there that are actually legitimate physicians, healthcare providers reporting their vaccine adverse effects on there. Patients may also report. So sometimes you might get double reporting, and then that way someone has to sift through that. And at the same time, there are a lot of people reporting on there who are just reporting false names and false information just to be able to boost the numbers of certain types of disease processes that don't even exist. I sat down one day and went through some of those, and I thought, this is amazing. Like the complications of the vaccine included a toe that had a purple spot on it. It's like, sometimes there's some of the entries are just not even accurate in what disease processes even exist out there. So I think you have to just be really careful where you get your information from, because most, like Shikha was saying, most vaccine adverse effects will happen within the first few weeks of any vaccine and not long term. And that's a big thing. This vaccine provides such a small amount of data into your body that within 72 hours is gone. If you think about all the processed foods that kids are eating, all the things that kind of go into the bodies these days that people have no idea what those ingredients lists are. This is just basically some sugar, some salt, some lipid. It goes in your body, you process it, and then you are the one that creates the antibodies, which is probably the most amazing thing out there. I find this to be just an unbelievable thing that our own bodies are doing. So that's just one other thing to think about.
Thank you. I love that perspective.
I love that.
And bringing.
I was going to say, it teaches you. It's teaching your immune system to fight it off, so that even if you get exposed and you get an infection, it's a mild infection. It becomes a common cold because your body is prepared, and that's exactly what the vaccine is designed to do. And that's how this ends, which is that we all have some instruction set in our own immune systems that allows us to fight this off without getting critically ill.
That's actually a great point, because this is a coronavirus, and coronaviruses are part of a family of viruses that actually are the most common cold viruses that we used to see, and we still will. Coronaviruses on their own are what probably most colds are when they come into the emergency room or in pediatricians' offices or their primary care. And this is just not the same coronavirus. And so that's actually something to think about too, is that eventually, hopefully, we'll get it to a point where it is, if you have the vaccine on board, just like the flu. We all are expected to get the flu shot every year as healthcare providers, and it's mandated in our hospitals that we do that. It's not as effective of a vaccine as the COVID-19 vaccine, yet nobody seems to complain about getting that vaccine. And it's something that we do to be able to prevent getting the flu, or if we do get the flu, that it's much more mild than it would be if we hadn't. We're exposed to that all the time too.
So I'm going to shift us to another kind of bulk of questions that we got, which was unvaccinated children spending time with vaccinated family and friends, or unvaccinated family and friends. And I know you had said that you had done a survey about this. And so people were just asking, what are the different safety precautions folks can take with their unvaccinated children interacting with different members of their family and friends?
So I'm going to let Eve answer the bulk of this one, but I just want to say that this is such a fluid topic that we have multiple text threads where we literally text each other and say, I was planning on doing this weekend. Is this a good idea? So I want to make the point that nothing is an absolute, and it's all about risk mitigation and what your comfort level is and who you interact with. For example, like I said, I have a 7-year-old, a 3-year-old, and a 3-year-old. I'm vaccinated, my husband is, my parents are, my in-laws are. So I feel comfortable spending time with them because all of the adults are vaccinated, even though my children are not. But there are other families who, even though the parents are vaccinated, I know that the parents are traveling, or they are being exposed to other people, or they are, they're going indoor dining, which I still do not feel comfortable doing. So they are putting themselves in situations that I might not feel comfortable putting myself in. So if we interact with those family members or those friends, I still require my entire family to wear masks, and we typically interact outdoors. My husband often gets very irritated with me because he thinks I am being overcautious, but he also says that I've gotten us to this point in the pandemic without any of us, knock on wood, getting COVID. So I think a lot, and I'm an oncologist, I see immunocompromised patients all the time, but when I see them, I'm wearing an N95 mask. So I think that it depends on your own level of what level of risk you're willing to take and who the people are that you're interacting with. When I interact with my friend who I know goes nowhere and sees no one and basically is a hermit and lives at home, and the only other person she sees is us, I may feel more comfortable with my kids interacting with her indoors. However, I likely will still have my kids wear masks because they are not vaccinated yet. So I still, anytime we're indoors, I have my kids wear masks. My daughter likes making new friends, and we were at a play structure the other day, and she made a new friend, and he wasn't wearing a mask. And she told him, I'm really sorry, I can't play with you unless you're wearing a mask. Would you mind putting one on? The kid pulled a mask out of his pocket and put it on. My daughter came over to me and said, Mommy, it worked. I said it really nicely, and he put his mask on, and she's 7. So I think that, until my kids can get vaccinated, they're going to be wearing masks around anybody who I feel might be doing things where they might be exposed to COVID. Because we also know, even if you're vaccinated, if you get a mild case of coronavirus, you can still pass it on to others. So, and then they may pass it on to my kids, who then might have a more serious viral infection. So that's what I do with my family. Indoors, kids are masked unless it's somebody who I really, really trust. And adults are also masked. Outdoors, my kids still wear masks whenever there's a lot of people around. Like if we're at the playground and things, and there's a lot of people who they're sharing air, is what I like to call it. I'll still have them wear masks, especially if there's people around where I don't know their vaccine status. And anytime we're in public, my kids, and actually all of my entire family, we are all wearing masks anytime we are in public, especially indoors.
Yeah. So, I'm very similar. So what I usually will start by just kind of going through what we actually came up with this with one of our partners, Dear Pandemic, to use your smarts. And the principles apply even with Delta, even 18 months later. And what that means is space. So keep your distance, mask, keep it on, air, keep it fresh. So staying outside or being in a very well ventilated space. Restrict, keep the numbers small to whoever you're interacting with. Time, keep the duration of interaction short, and shots, get your shots. And so it's kind of use your smarts, and that principle really applies. So what we do, I never took off my mask indoors in public, even after the CDC announcement came at the end of May. And my children we don't bring them into stores or anything inside, but if we had to, it would be masked, of course. We don't do indoor play dates. We do everything outside, and outside, as long as it's not a crowded outdoor arena, I don't make my kids wear masks, but we also live in an area where we don't have a very high rate of transmission. I think the way to kind of judge an activity is really what Shikha said, which is you don't want people who are unvaccinated in the same room swapping air. And that means that you don't want to be breathing in and breathing out the same air that someone else is if everyone is unvaccinated. I haven't been indoor dining since this started. I don't think that I'll be doing that for a while, moving forward, but I will go outdoors. And so I think I try and keep everything outside. Our kids do outside play dates. We are starting school in person, and they will be masked, universal masking. And most of the teachers and staff are vaccinated. But in terms of activity lists, think about just, when you're gonna, things that are higher risk, and this is in our survey, it would be if you're inside or if you're projecting a lot more air. So high intensity exercise, breathing into, a smaller space where people are really huffing and puffing, that's going to be riskier than something low intensity. Singing in an indoor space, we know has been associated with multiple outbreaks. And so, you don't want to do an indoor singing or, playing instruments where you're going to be blowing air inside. But you can move it outside. You can space people apart, and always have masks available so that you just don't have to risk the air exchange. And again, it's a very fluid situation, and exactly what Shikha and Hala had said, which is we are in a constant calculus of trying to figure out what is safe and what is unsafe, because it changes, and it changed from June to July to August. And the other thing I will say is, everyone has a different level of risk tolerance, and everyone has a different situation. You don't want to make assumptions about anybody. You don't know who they live with. You don't know their own medical conditions. You always want to lead with kindness and empathy, and you don't want to judge people. But, have your own line in the sand, know what you are comfortable with, and then just continue to follow rules that are in line with what your comfort level is to keep your immediate family and your loved ones safe.
Hala, do you have anything to add to that one?
Well, it's a lot easier for me since both of my kids are vaccinated, so we don't have to worry about it as much. But definitely it does become an issue for them when they're with friends who are not. So sometimes we do have to take those scenarios in mind. I'm very fortunate also that in the group that my daughter hangs out with, most of them are all vaccinated, and my son the same, maybe a couple of them. And interestingly enough, they do have some of their own dilemmas where the parents are vaccinated and they are very much pro-vaccine, but they have some questions about kids and their own kids, and they are a little bit more hesitant and reluctant to vaccinate their own children. And that is a very, very slippery slope to be on. You don't want to be the one to kind of push that. You just want everybody to feel very good about the fact that they're giving their child a vaccine and own that. And to me, that's actually one of the most important things. I feel like any conversation I've had with any parent has led to them being able to vaccinate their kids. And I feel very fortunate that people are willing to talk and listen when they do have a question about that, because I think a lot of it is just those two questions that are just kind of nagging on their minds or whatever it is, and they just want to be able to talk it out with someone. Same in the emergency rooms. We finally are able to give vaccines in the ERs, and for me, it's very nice to be able to do that because I can have a conversation with someone, although there's not always a lot of time. But it's still, even to be able to answer one or two questions is kind of nice because they finally have someone in front of them that are able to have that conversation that they haven't been able to have, or versus being able to see what's going on Facebook. So that's a slightly different position for me. And I feel lucky that for now we've been able to. Of course, it's coming up now where they're hanging out in groups, and we have to be able to talk about when they will start wearing masks again. Outside, it's been summer. They've been outside the whole time. They really haven't been inside. With summer coming, it's going to be a little bit harder to turn them around. I know my son was talking about he turned 16 in a few weeks, and he wanted to have a group of people over. And we've been discussing how that will look. And if it's outside, it should be okay. I'm a little bit more hesitant to bring all these kids inside the house. So.
And just kind of to follow with what Hala said, we actually have an entire series of kind of myth debunking infographics on our website, which we create based on the myths and the questions that people are bringing to our attention. So, I see patients all day long. I've sent multiple patients today to go get their vaccines because, a lot of them want to have a lot of questions. But we're trying to kind of prophylactically put that information out there. So when it comes to questions about, fertility, we put that out there, that, that there's no risk there, that is complete misinformation. And so, you can look through what we have, and we can certainly share that. But if there are rumors or questions, the key is to ask a trusted professional, ask somebody who knows the answer, or to go to a source that's really a reliable source. So the CDC, look at American Academy of Pediatrics. I know I keep saying both of those websites, but the Infectious Disease Society of America. Go to these trusted resources, and that's where you're going to get your answers. Because some of these myths, we've heard them all, and some of it is really just questions and concerns, but a lot of it is intentional disinformation that's an organized kind of campaign to really spread these rumors that have direct harm to them. And so you want to make sure that when you're seeing things that sound a little outrageous, or that sound really, really concerning, that you fact check that. And you can come to our website, you can ask us on social media, or any of the trusted resources that I mentioned, and make sure that before you make a decision about what you want to do for the safety of yourself and your kids, based on something that you hear or that you read online, that you want to make sure it's true, because there's some serious repercussions.
Okay,
go ahead. No, go ahead, Ella.
One of the things that we found very successful also is that we paired up with a lot of different schools, and we actually spoke with kids in schools. We had Zoom sessions where kids got on, and 50, 60, 70 of them, and they were asking us questions. And I found that some of the best questions and the most honest, and just some of the best questions were asked by kids, because they were not motivated by anything political. It was just pure understanding of what they were doing. And also from what they heard also on social media. They're on TikTok, they're on Instagram, they're on Twitter. They see things that sometimes may or may not be accurate. And it was nice for us to be able to help debunk some of those myths as well. And having a kid be able to ask themselves is very valuable. So if you ever are able to do that, connect professionals to the schools, that's also a very valuable thing.
And we're happy to come in.
Going back to your original question, Alia, about unvaccinated kids socializing and spending time with vaccinated individuals, I also want to make the point that there are places in the country right now that I would not travel to. I'm going to say Florida and Texas are two places right now I would not go. And if you have family there and you have children who are unvaccinated, I would not visit them or have them visit unless they are vaccinated and they have a plan to quarantine ahead of time. The risk and the concern is when the numbers are so high in certain areas, even if people are vaccinated, if they're coming from those areas and then interacting with unvaccinated children, for example, there is a much higher chance that they may have COVID, even though they're vaccinated, and then potentially could transmit it to your unvaccinated children. So I get a lot of questions about travel and traveling around the country. And I will tell you, I have flown once during this pandemic with all three of my children. And it was when numbers were low and I had my kids masked. I masked. We had, it was a very short flight, and we did all of the things that we needed to do to make sure that they were safe and we were safe. And we were flying from a state that had very, very low numbers to another state that had very, very low numbers. So I felt safe doing that, and we were able to do that safely. I will tell you right now, I would not feel safe bringing my children on a flight to many places because of the way the numbers are. And again, there's no sign on someone's chest that says whether they're vaccinated or not, or whether they have COVID or not. So, I have a lot of friends who live in states where the numbers are surging out of control right now, and they're having a lot of difficulty figuring out how to keep their families safe. And so, again, our conversation with you is coming from a state where our numbers are not as dire as some other places. So some of our recommendations may be based on areas that are lower transmission rates, but in areas where there's higher transmission rates, like I likely would not be doing some of the things that I'm doing with my kids here in other states, just because I wouldn't feel like it was safe.
Absolutely. And our hearts really do go out to you guys in some of these states. And we, I think I'm not sure that I would send my kids to school right now in certain states. And that's a really hard thing to say. I think if you are in a state that has the numbers that we're seeing coming out of Florida and Texas and Oklahoma and Louisiana, and you don't have a mask mandate and you don't have a vaccination rate that's, above 30 or 40%. I mean, the numbers are low. Like I would really be wondering. And I think in that situation, there is a lot of nuance to it. And some people, you would certainly not be faulted for not sending them. I think obviously we want our children in schools, but we want our children healthy and out of the hospital and safe as well. And so, the best things that you can do to keep your kids safe are just to know what's happening in your local community and to know, to understand kind of just how much COVID is spreading there. And then to really make sure that you're doing everything that you can to make sure you and anyone that you are close with is getting their shot, is fully vaccinated. And I think travel, again, we traveled once as well. I'm not sure when I will travel again. Certainly not right now on a plane.
And I think what's great about this conversation is also reminding people that there's not like a one size fits all approach to any of this. And if people are feeling uncertain or like they don't know what to do, that's a really normal experience right now. We're dealing with things that we haven't dealt with before at this kind of scale. It's about staying informed. It's about risk management, and trying to stay ahead of things as much as possible. We did have some questions about boosters. I know that's something that's on a lot of people's minds, especially with some of the some people getting immunocompromised people getting booster shots. And so folks are just asking, when are boosters available? Also, if they've taken one kind of vaccine that's less effective, should they switch when they get the booster? So if you have any thoughts about that.
So I will tell you from a booster standpoint, as an oncologist, my entire patient population has been like banging on the door for months asking me when they can get their booster. And I am 100% sure many of my patients went out and got a booster in the last couple of months and just didn't tell me. But now I will say that there are boosters that are available for patients who are considered to be immunocompromised. And there's a whole list of who those people are, whether you fall into that category. If you're, for example, a transplant patient, or if you're somebody who's getting chemotherapy, or if you're on any medication that suppresses your immune system, you are a candidate to go get a booster, and you can walk in and say, I need my booster, and you can get it. With the mRNA vaccines, there's been a lot of crossover where people have either gotten Pfizer or Moderna, and then their second, or sometimes their booster shot, they've gotten the other one. Both mRNA vaccines are pretty equivalent, so I don't think there is a big difference as to whether you get the Pfizer or the Moderna. If you got Johnson & Johnson, I think most people are going to be getting an mRNA booster. So I think likely Pfizer and Moderna are going to be most likely the ones that you're going to be getting. But again, you can ask your doctor, do I fall into one of these categories? But if you're somebody who is on any medications that suppress your immune system, or if you've had any sort of transplant, then you would fall into that category. And I would encourage you to get your booster if you are somebody who falls into that category. For everybody who's not in that category, it is very likely that boosters will be coming at some point in the near future. Again, just like the question about when it's going to be approved for kids under 12, I don't know when we're going to see boosters approved for everybody, because we're still trying to get that, coveted first shot into a lot of people to increase our overall vaccine rate. So supply and demand being a question, and really trying to focus on that first shot for people, I think is right now what the CDC, the FDA, and the country is focusing on. But I can imagine that boosters will likely be something down the line that we all will be encouraged to get. But for now, if you're immunocompromised, go ahead and go get your booster, because there's data that shows that it can help protect you, especially if you don't mount as robust of an immune response as somebody who has a fully functional immune system.
And I think it's important that, for this very, very narrowly defined immunocompromised group, it's not really a booster. It's just finishing their vaccine series to get them to where everyone else is with 2 doses. Because what we have to remember is this: we have a global pandemic, and there's a huge equity issue in terms of getting vaccines distributed around the world. And the pandemic really only ends when we have vaccine distribution everywhere. We don't have the data yet that if you don't have one of these, severely highly immunocompromised situations, that a booster, it is too soon to get a booster. And, the recommendations will come when the studies are completed and when the efficacy is there. But I'm certainly not running out to get one, even though I'm 8 months out from being vaccinated. And I would say that's true of many physicians and scientists and people who are following this data closely. The other thing that's really important is even people who don't have necessarily the exact same robust response to the vaccines that we were initially seeing right out that's not who's in the hospital, right? So the people who are being hospitalized, the people who are dying are the unvaccinated. And so we really need to keep pushing for people who have not had any of their shots to get fully vaccinated. They need both of their shots of mRNA, or they need the Johnson & Johnson vaccine. Any of whatever vaccine they choose, just to be fully vaccinated, because that's really what's driving these crises that we're seeing in many states across the country. And so while we all are nervous about our immunity waning, we are really not seeing that. Even when we say breakthrough infections, which is not necessarily a great term, but we're seeing that you can still get sick if you have been vaccinated. We're not seeing the hospitalization and the severity of illness. And so what that means to me is that these vaccines are really a home run. And so, if everyone here goes out and convinces one person to go get vaccinated, that would be an enormous movement that would help this entire pandemic, get us closer to the finish line.
My mom is not a physician, and she's out there convincing people to get vaccinated. She called me the other day and said she convinced her Uber driver because they were just talking about it. And she said, my daughter's a doctor. Do you have any questions? And she literally convinced her Uber driver to get vaccinated. So you don't have to be in healthcare to convince somebody to get the vaccine. I mean, it's as simple as a conversation. And I totally agree. We could totally change the course of this pandemic if we manage to get more people vaccinated quickly.
It is amazing how just that one conversation can really do it. I had, there was a guy at our house the other day spraying for pesticides for pest control outside. And I just happened to ask him, like, have you gotten your vaccine yet? And he's like, no, I'm not 100% sure. We had like a 5-minute conversation. He's vaccinated now. So it's amazing how I think I'm that annoying person who randomly will see anybody like, any questions about any, I think we all can be that person, we're all in this together.
In fact, we need everyone to be that person. We can't do it, certainly, don't have the bandwidth, but we also don't have the audience that, people in the community have. And, if you're a trusted member of your community, go out there and just kind of lead by doing, be an example and answer your questions, point people towards the right sources, try and combat some of the disinformation with us. I mean, it's going to take all of us. My 6.5-year-old has tried to convince many people to go get vaccinated. And, it doesn't matter how much you know about science, but I think it's important that we all be a trusted messenger with this message.
That's the biggest thing. Some of us are really starting to get tired, honestly. Like your healthcare workers are a little bit, I think, both exhausted, slightly morale is low in some places. And, we try really hard to kind of boost each other up all the time, which is why I'm so grateful for this group, because Impact has just kind of kept me kind of pushing along. Every so often, some of us might check out for a little bit, come back in, because we just need that small break. For example, one great thing that this week was the news that ACOG, the American College of Obstetricians and Gynecologists, really said that they are recommending the vaccines now for sure. And with only about a quarter of pregnant women vaccinated in the country with one vaccine, and in our African American Black population, it's only 10%. This is something that is a huge positive message for us this week. So I love that. And I love that one by one, I think more societies and organizations are starting to jump in and really put their feet down and say, we really back these, not just kind of recommend them, but really pushing them and saying we need this, we all need to be out there kind of voicing that opinion.
And I want to bring this back to something Alia said at the very beginning. Women in general, and I'm going to stereotype, but I think it's based on fact. Women in general move communities. They move mountains when it comes to this type of thing. My father-in-law made the joke that nobody in our family would be vaccinated if it wasn't for me. And my husband and my father are both physicians, but I'm the one who pushed everybody to get vaccinated. I put them in for the lottery. Like, I literally was on the phone, on the computer, and I got everybody vaccinated. And my father-in-law made the joke. He said, without you, none of us would be vaccinated yet, back in December, January, or February, whenever I got everybody vaccinated. And I've seen it amongst women across the board. I mean, women are your mothers, your daughters, your sisters, your PTA leaders, women really have this ability to form a community and move mountains. And I am so impressed with the women I've seen in our communities out here with, from my kids' schools, the mobilization that's happened amongst women. And like I said, you don't have to be a mom. You don't have to be, a healthcare worker. You don't have to fall into a specific group. Each of us has the power within our voice, within our position in the community, within our families, to convince people to get vaccinated, to wear a mask. I mean, it's as simple as my 7-year-old, asking that kid when she was playing, hey, can you put your mask on? People are willing to do these types of things. They need somebody else sometimes to help push them over that line or help give them some guidance in a non-confrontational kind way. And we are so positioned to do this. I mean, this is innate in our communities. So I want to strongly encourage anybody who's listening or anybody who has the opportunity to convince people to get vaccinated, talk to them about it, answer their questions. If you don't know the answer, direct them to us, direct them to your local healthcare providers, direct them to somebody who can help them, because honestly, this is not going to end without all of us really pitching in. And women, I firmly believe women move mountains, and we can do so much to change the flow of this pandemic if we just all band together and work towards moving our little needles in our own communities as much as we can.
That was amazing. That's basically the pitch for the Super Vaccinated Pledge. So if folks go on there should be a link to the Super Vaccinated Pledge, which is exactly that, which is, it's not, we can all get vaccinated and that's great, but then we can also do more, and we can be talking to our friends and family. It's not just about fighting disinformation, but also spreading good information. So making sure that when you hear those guidance, if you know folks who aren't vaccinated, if you know folks who are feeling hesitant, to be able to share that information with them, to be that reliable source, to proactively ask people. I think people are feeling hesitant to have those conversations with friends and families and neighbors. But if you're seeing someone, to talk to them, to ask them, so that you can have those conversations, that we can all be doing our part to get us through. And that extends even beyond just getting vaccinated. So thank you so much. We are at time. This was a wonderful conversation, so helpful. I know I learned things. I'm sure that our members did too. I know there are some questions in the chat that we didn't get a chance to. So if you have a chance to respond to some of those after this, but thank you so much for being here. If you have any last thoughts, feel free to share them. But I'm just so grateful that you were able to spend this afternoon with us.
I just want to say thank you for creating this platform, Alia. Like, we really appreciate you inviting us to speak today, because again, it takes a village, it takes a community to do this, and we appreciate you putting out good information and working so hard to getting this important messaging out there. So thank you for having all of us today.
Thank you so much.
Absolutely. I agree. And if anybody wants to get involved, check us out on our website, and we're always looking for good ideas and for people who are dedicated to just helping us get through this. And so we'll make sure that's there too. And we'll try and go back to the comments later today and try and answer some of those extra questions for you as well. Stay safe out there. This will end.
Yes. Just breathe. Keep breathing.
With a mask on.
Yeah, I was going to say.
Actually, don't breathe. No.
Amazing. Thank you so much. Thank you again.
Thank you, Aaliyah. Thank you so much for having us.
Bye.
Bye.